And exercise. When you talk to them as exercise as a whole, what do you recommend when they come in and they say, okay, I got to get back on track.
Right.
You know, I've been sitting too long. I'm not moving enough. I need to move.
Well, interestingly, the American Diabetes Association just published results of a study that showed that if a person is involved in an exercise program for 8 weeks, they can see a reduction in their hemoglobin A1C of about 0.66%. And this is just with exercise.
Is that significant? Because you're saying a number that maybe a lot of people don't understand. So break it down for me and keep it simple. That's significant?
It is a significant number considering that it's one small change that you can make. Wow. So if this is one small change and then diet is another change and medication is another change, I mean, we can start seeing real big increases in hemoglobin A1C.
Not only that, but 0.66% is on average more or less what one drug drops the A1C. So it's equivalent to taking one drug.
So there is a combination of possibly that medication with that exercise. Well, you'll start seeing that decrease, which is very encouraging. I'm not saying you can't get off the medication, right? Because that's what you said.
Right.
But it could be a positive sign for a good direction that we're going in.
Right.
And better control and fewer complications later on.
Correct.
Doctor, go ahead if you want to chime in.
No, I was going to say, I mean, you can get off medications sometimes you can't.
Right.
And frankly, there are some medications that you might want to stay on. I mean, this is a discussion you have with the physician, obviously, and depending on how effective the lifestyle changes are implemented. But there are situations in which I talk to patients, we have a discussion, and we conclude, well, hey, you're doing great. You could come off of metformin, for example, but why don't we keep you on a low dose metformin? This may help you long term to decrease that progression. So medications are not the enemy. We have to prescribe them rationally and appropriately, but it's a discussion that one has with the patient.